Hello all, this is Dr. Vibhash Vaidya, and today in this video we're going to discuss about the gross anatomy of heart. So let's begin the gross anatomy of heart. The heart is a conical hollow muscular organ situated in the middle mediastinum. It is enclosed within the pericardium. It pumps blood to the various parts of the body to meet their nutritive requirements. The Greek name for the heart is cardia, from which we have the adjective cardia. The Latin name for the heart is cor, from which we have the adjective coronary. The heart is placed obliquely behind the body of the sternum and adjoining part of the costal cartilage, so that 1/3 of it lies to the right and 2/3 to the left of the median plane. If we're talking about the heart measurement, the length of the heart, length taken from the apex to this most superior portion, this length is heart about 12 centimeter and width is about 9 centimeter, and weight of the heart in male about 300 gram and in female it is about 250 gram. Now we'll discuss about the external features of the heart. Now here you can see this is the specimen of the heart, and the human heart has 4 chambers. As you can see here, it has 4 chambers, 2 ventricles, right and the left ventricle, and right and the left atria. Behind you can see this is the right atria and this one is a left atria. The atria lies above and behind the ventricle. As you can see here, this is the ventricle, and just behind and above we can see this is the atria. If we observe on the surface of the heart, we can observe over here the atria and the ventricle is separated from by the atrioventricular groove. Here you can see this is the atrioventricular groove. You can also observe on the left side, this is the atrioventricular groove. Here we can see this is the right atria, this is the left atria, and these 2 atria is separated by the interatrial groove. This is the interatrial groove. The same manner here we can see this is the 2 ventricles, and this 2 ventricle is separated by this interventricular groove. You can observe here this is the interventricular groove, and this interventricular groove is subdivided into 2 parts, the anterior part and behind here this is the posterior part. So this is the posterior part of the interventricular groove. In the same manner, the heart has an apex. You can see this is the apex of the heart, and this apex which is directed downward and forward and to the left side. Here you can see the apex which is directed downward, forward and the left side, and it has a base. Base is also considered as a posterior surface. So this is the posterior surface, and this posterior surface considered as a base, and this base which is directed backward, and it has 3 surfaces: the anterior or sternocostal surface, the inferior surface, this is the inferior surface, and the left surface. So heart has the 3 surfaces: the anterior surface, and this anterior surface is also known as the sternocostal surface, the inferior surface, and this inferior surface is also known as the diaphragmatic surface, and the left lateral surface. The same manner, the heart has a border. The surfaces are demarcated by the upper border. Upper border is visible when we remove this great vessels from here. Then we can appreciate this is the upper border. It has the inferior border. This is the inferior border of the heart, and the right border. Right border lies between the superior to inferior vena cava. This is the right border, and the left border. This is the left border. Now first we will discuss about the grooves or sulci. The atria are separated from the ventricle, as we told you earlier, this atria, this two atria, which is separated from this ventricle by this atrioventricular groove or coronary sulcus, which is divided into anterior and posterior parts. The anterior parts consist of the right and the left half. Here you can see this is the right half of the anterior part and this is the left half of the anterior part. The right half is oblique between the right auricle. This is the ear-like small process in the right atrium, and this is known as the right auricle and the right ventricle. Here you can see this is the right half of the anterior atrioventricular sulcus, which is oblique, and it lodges the right coronary artery. Here you can observe this is the right coronary artery, which is lodges in this right half of the atrioventricular anterior part of the atrioventricular groove. The same manner, the left part is small. Here we can appreciate this is the left half of the anterior part of the atrioventricular groove, and it is small and it lies between the left auricle. Here we can see this is the left auricle and the left ventricle, and this left half of the anterior part of atrioventricular groove, which lodges the circumflex branch of the left coronary artery. Here we can see this is the circumflex branch of the left coronary artery here. In the same manner, the coronary sulcus is overlapped anteriorly by the ascending aorta and the pulmonary trunk. You can observe over here the coronary sulcus. This is the coronary sulcus, and this coronary sulcus is overlapped anteriorly by the ascending aorta. This is the ascending aorta and the pulmonary trunk. Here we can see this is the pulmonary trunk, and it is overlapped anteriorly by this coronary sulcus. This is the coronary sulcus. The interatrial groove is faintly visible posteriorly. Here we can see this is the interatrial groove, and it is faintly visible posteriorly, while anteriorly it is hidden by this aorta and this pulmonary trunk. So here this is the interatrial groove. The anterior interventricular groove is near to the left margin of the heart. Here we can see this is the left margin of the heart, and nearer to the left margin of the heart, this groove is a anterior interventricular groove. It runs downward and to the left. The lower end of the groove separate the apex, the rest of the inferior border of the heart. Here we can see this is the lower part of the groove, and which is separated by this apex of the heart from the inferior border. The posterior interventricular groove, here we can see this is the posterior interventricular groove, and this posterior interventricular groove is situated on the diaphragmatic or inferior surface of the heart. Here this is the diaphragmatic and inferior surface of the heart. It is nearer to the right margin of the surface. Here we can see it is nearer to the right margin of the surface. This posterior interventricular groove and this anterior interventricular groove meets at the inferior border just nearer to the apex of the heart. This is the apex of the heart. Now we'll discuss about the apex of the heart. Here we can see this is the apex, and this apex of the heart is formed entirely by the left ventricle. This is the left ventricle. It is directed downwards, forward and to the left, and it is overlapped by the anterior border of the left lung. This apex of the heart is situated in the left fifth intercostal space, about 9 cm lateral to the mediastinal line, just medial to the mid-clavicular line. In the living subject, this apex of the heart, pulsation may be seen at felt over this region. In the children below 2 years, apex is situated in the left fourth intercostal space in the mid-clavicular line. Now the base of the heart. Here we can see this is the base of the heart. Base is also known as the posterior surface. And this base of the heart is formed mainly by the left atrium. Here we can see this is the left atrium, and by a small part is formed by the right atrium. This is the right atrium. So the left 2/3 part of this base is formed by the left atrium, and right 1/3 part is formed by the right atrium. In relation to the base, one can be seen the opening of the 4 pulmonary vein. Here we can see, here in the base we have the opening of 4 pulmonary vein. This is pair of right pulmonary vein, and on the another side here we have pair of the left pulmonary vein. In the same manner, the superior vena cava, this is the superior vena cava, and this is the inferior vena cava, and this superior and this inferior vena cava which open into the left atrium. So this is the left atrium, and it is related to thoracic 5 to thoracic 8 vertebra in lying posture. It is separated from the vertebral column by the pericardium. Now the borders of the heart. So as we discussed, the heart has the 4 borders: upper border, the left border, the inferior border, and the right border. So here this is the upper border, and it is formed by 2 atria. Here we can see the right and the left atria, and these 2 atria form the upper border. In the upper border, chiefly it is contributed by this left atrium. This is the left atrium, and small part of this upper border is formed by the right atrium. So this is the upper border. Now the right border. So here we have the right border of the heart, and it is formed by the right atrium. It extends from the superior vena cava to this inferior vena cava. So in between these 2 large vessels we can see this is the right border. Now the inferior border. Here we have the inferior border of the heart, and this inferior border is nearly horizontal, and it is formed mainly by the right ventricle. So the large portion of the inferior border is formed by this right ventricle, and the small part of this inferior border. So this is the small part of this inferior border which is formed by this left ventricle, and this inferior border lies in between this apex to this inferior vena cava. So this is the inferior border of the heart. Now the left border. So here this is the left border of the heart, and this left border is oblique and curved, and it is formed mainly by the left ventricle. So this is the left ventricle, and whole of the left border is formed by the left ventricle, and partially by the left auricle also contributes the formation of this left border. So here we can see this is the left auricle. This left border lies between the apex to this left auricle. So here this is the borders of the heart. Now the surfaces of the heart. So as we discussed, the heart has the 3 surfaces. Some books written the heart has the 4 surfaces. The base also considered as a surface. So first the anterior surface. So here this is the anterior surface, and this anterior surface is also known as the sternocostal surface. And here we can observe the sternocostal surface is formed mainly by the right atrium and this right ventricle, and partially it is formed by the left ventricle. So this is the left ventricle and small part of the left auricle. The left atrium is not seen on the anterior surface as it is covered by the aorta and pulmonary trunk. Here this is the aorta and this is the pulmonary trunk. So in this view, the left atrium is not seen. Now the inferior or diaphragmatic surface. So here this is the inferior surface, and this inferior surface is also known as the diaphragmatic surface, and this surface is rest on the central tendon of the diaphragm, and it is formed in the left 2/3 by the left ventricle. So here this is the left ventricle. So major 2/3 portion it is formed by the left ventricle, and in the right 1/3 part, so this is the right 1/3 part, and this right 1/3 part is formed by the right ventricle. It is transferred by the posterior interventricular groove. So this is the posterior interventricular groove, and it is directed downward and slightly backward. Now the left surface. So here this is the left surface of the heart, and this left surface is formed mostly by the left ventricle. So this is the left ventricle, and at the upper end by the left auricle. So small part of this left surface is formed by the left auricle. In its upper part of the surface is crossed by the coronary sulcus. So here you can see this upper part of this surface, it is crossed by the coronary sulcus. It is related to the left phrenic nerve, the left pericardiophrenic vessels, and the pericardium. Now the crux of the heart. So crux of the heart is meeting point of interatrial and the atrioventricular and posterior interventricular groove. So here this meeting point is known as the crux of the heart. So it is the meeting point of interatrial. Posteriorly, here we can see this is the interatrial groove, and the left and the right half of the atrioventricular groove, and the posterior part of the interventricular groove. The meeting point of these all the groove is called the crux of the heart. So this is all about today's demo. I hope all of you understood the topic. Thank you for watching.